Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. That's everything.
Well. Pampering time.
Oh, yeah, right. That's right. Boy,
we're gonna send Richard to get pamper for the holidays.
Pamper. Well, Dr. Mencia, I'd like to congratulate you on a new birth.
Yes. Well, an old birth that is brand new.
It's a very big story. Why don't you share with the audience what you have just done?
Well, I've been doing aesthetic. There's a lot of people that do aesthetic as a way of life. They don't get a lot of medical patients. And to complement their practice, they just do aesthetic, and it becomes a source of, a good source of income for them. As a medical doctor, we all understand the huge need that's out there for MD to provide good medical service to the community. But my passion with aesthetic have always been there.
Well, you look like it. You've kept yourself like that, so it's very important to you.
I have to walk the talk. So, yes, I attempt to be very healthy, take care of myself, exercise, live a very disciplined life. And it's a train towards success. So jump on the train or miss the train. So it had been my life. And yeah. So
got a new train though here.
Well, so a good friend of mine that used to own, the last person that owned Stonewater Spa, came to me and said, I'm relocated to Las Vegas. And we had spoken in the past about making it a med spa, me and him. But we talk, and then he go back to Las Vegas. We don't talk again. And whenever he come to see me for his annual physical, we always bring it up, and then he leave. Well, this time, he said, I want you to have it. I want you to have Stonewater. Just purchase that from me, take it off my hand, and you do whatever you want to with it.
Whoa.
And I say, wow, what a great opportunity. But I will not take the credit. I will tell you this much from the get-go. I think, the whole team over there, Ina, Leskowitz, and Claudia Gega, Rosemary, they all deserve the credit, not me. Because, the opportunity came on my lap, but my accountant, Claudia, and my executive manager, Ina, they call her. She get mad at Ina. It's not Ina, Ina, I-N-N-A. So, they took over, and they sat down with the previous owner, and they managed through the whole thing. They set up a big meeting with all the staff. We're keeping the staff put the way they are. We set up a big meeting with all the staff, and it was. I think it was a great meeting because I wanted them to know where I'm coming from as the new owner, and I wanted to get to know them. How long you've been doing hair, how long you've been doing nail, how long you've been doing aesthetic, how long you've been doing massage, and so for the first time, Stonewater, that I had been going there for a good 20 years since I first relocated to Florida. Never thought in my life that I would own this place, that I would just go and get the services. The services are great. And anybody that Google Stonewater Spa will probably recognize that it had been there for 26 and a half years in the same location. So that says a lot about
It's in Fort Lauderdale on Oakland Park Boulevard, for those of you just listening.
Right, East Oakland Park. It's 2767 East Oakland Park, right next to Bayview, Oakland Park and Bayview, in that location, just before the bridge. So I used to live in Sea Ranch Lake when I first relocated here in Florida. And I remember when my girls moved to Delray, they would come down because they were so used to the staff at Stonewater. They would come down to get their eyebrows done or what have you.
The nails, pedicure,
the nails,
right?
the facial. They would still come down. So, they grew up in this place. So I think, to us it's something very close. It's not just another business. It's something that we can now integrate and put some of the weight loss program that we have into the spot, make it a true medical spot, not only just the hair removal and the fat reduction, but work on all of that plus, health related.
Well, something extra. I know you want to talk about it, but I have to just interrupt you and tell you thank you for the visit.
Thank you for coming.
I was thrilled. I mean, I didn't know how good this was going to be, but knowing you wouldn't do something casually. And I went there, and my mouth would have, dropped. I mean, it was gorgeous, but something that I had heard about, and I've been threatening to go. There was one, I think, up in West Palm Beach, salt bed treatment, and this is absolutely healthy, and it's exciting. I can't wait to have my first treatment.
It's excellent for the skin. It's an
salt bed. It's like a salt room. It's a cave. It's a
capsule.
Salt bed.
Yeah, it's like a capsule. You up in the capsule. You sit in the bed, and the salt treatment get vaporized, and it's excellent for most skin conditions, psoriasis and eczema, and all the skin condition. It's excellent. I have not tried it yet because I've been so busy in the administrative part and the.
Well, I'm going to try it too. We're going to both do it. But I think what's happened is this isn't just a typical spa boutique where you get your nails done and your hair done. This has a lot more to it. The rooms also, I don't think Ina even realized that, but the massage rooms, the beds have a little electric blanket. So when it's very beautifully done. Yeah. I mean, I've been to enough places to tell you that you really have something special. But now that you're going to be a part of it with your medical practice, it's going to grow like crazy.
Yes.
I'm very thrilled you've done this.
Yeah.
Merry Christmas.
Merry Christmas. Happy Hanukkah. No, it will grow. I think, basically something that we can integrate into AGI because, in AGI, of course, we've been doing weight loss. We've been doing, weight management for such a long time. Nicole got so excited when she heard, because she used to go there too.
Is that right?
Yeah. Nicole Andrews say, oh my God, I used to go to Stonewater, my favorite place when I used to live in Fort Lauderdale. Now she moved to Boca. But she said the same thing. I used to go there, and when I first moved to Boca, I used to travel down to Oakland Park just to go to Stonewater. So
this is such a coincidence.
She's so excited. She said, oh my God, we can put the product there so when the people come, because, all of the product that we distribute at AGI, we have done the research, especially Courtney and Nicole. They have basically done all the research on what would be the ideal product at a reasonable price. Because, a lot of products, they are inflated in prices. And people will buy because of the color of the container or what have you. But a lot of things are overpriced. So we look at the ingredients, the absorption, the way they are made, and the prices.
By the way, I'm out of vitamin D.
Okay.
I had to come down and get it. I meant to call you and ask you to bring
you should have. If you would have texted me that, would have brought it for you.
I know.
Yeah.
I love the vitamin D.
So we just got the credit card. Oh, the beautiful sunrise. Oh, my favorite part. We have to have the owner of the building just twist it a little bit so we can
it's really pretty beautiful. Yeah. But this Stonewater's medical spa now is going to be open a lot. I mean, it's open
7 days.
7 days.
Now we are at 6 days. We are only closed on Monday. But it's going to be very soon. As soon as we get all organized. We're using Mondays as our day of cleaning and restructuring thing. But it will be open 7 days.
So for those of you listening, it is open now, though, and I want to tell you, is it open on Saturday?
It's open on Saturday. All Saturdays
all
our
right.
way to
we
go.
got to give a
and
phone
Sundays.
number. Got to give you a phone number. It's 954-561-8799, 954-561-8799, and the address is 2767 East Oakland Park Boulevard. You can go on the website. It's stonewaterflorida.com. It's all going to be, a lot of things will be added, but it will give you an idea. It is really first class, and because Dr. Mencia is involved in this, it is now going to be a med spa with all the extra treatments he's telling you about, and we'd like you to go and tell us what you think, right?
Yeah, absolutely. We would love to hear, and I've been giving the flyers to my patients. I say, if you do go there, please just give me some feedback. I want to know what you think. Because that's how I built my reputation as a medical doctor. I have listened to my patients for the past 20 years, and they give me advice. I remember I used to go to some of the retirement community myself and provide the service because the people go, no, I want to see Dr. Mencia. So I would say, okay, let me take half a day and go there. And I did it for one facility, then I did it for another facility, and one of my patients sat me down on a chair. He goes like, what is it that you are doing? I said, well, I'm trying to provide good geriatric care, and I want to bring it out to as many people as possible. She goes, let me tell you something, my son. You are only one person. Your concept is great, but you cannot carry your concept on your shoulder by yourself. Get yourself other doctor. Get them in there to do the work. You supervise to make sure they are doing things the way you do it. And you need to stay here put, because when I'm sick and you are not here, I feel really bad. And I don't want to go to an emergency room, because you always talk about against going to an emergency room if it's not a true emergency.
So a patient told you this.
So, yeah, she sat me down, and, I got my managers and my staff. And I said, okay, let's get some doctors, so some PA, nurse practitioner. Let them continue to grow that arm. And that's how we grew the home visiting program, the assisted living facility providing service, retirement community, going into retirement community and opening an office there so that we can provide the service for the community so they don't all have to come out to go to a doctor. We go to them. And, I listen to my patients. So I've been telling my patients, please go by Stonewater and get whatever service you want to get and give me some feedback. Tell me what you think. Tell me what can I do to make it the best thing in all of South Florida.
Well, let me just talk about something, because massage...
And it's not a small spot. It's a big spot.
It's a very big spot. I mean, it goes room after room after room. I was just so impressed with what you've done there. But the nice thing is that, and I've been telling people to get massaged. Everyone gets their nails done. But there's nothing like a massage, and it will keep you healthy.
Right.
Now, did you get a massage?
Oh, one of the massage therapists, she just got married last weekend, Maria. I've been seeing Maria for over 15 years, and I go to her for deep tissue massage. And I've been following her. She used to be with Stonewater, then she left Stonewater. Wherever she goes, she will always contact me. Dr. Mencia, I'm here if you need your massage. And I would just follow her. She was, she's so great. And I love the deep tissue massage, And when the owner say, guess who's working at Stonewater? I say, who? Maria is working there. I say, that's it.
So Maria, so now it's going to be at your spa, the woman that you've been following so
for
good.
15 years. She's,
Isn't that exciting?
And I'm going to tie her down to the bed. Right? She's going nowhere.
That's very, very exciting. And so you have, let's just go through it. When I walked in, there is a beautiful fountain.
Yes.
That's a big, on a glass that the water comes down on black rocks, which is very nice. And then it looks like you have, so you're going to be selling some jewelry and a few nice little things. Like they do this at Hard Rock,
Yes.
When you go to Seminole Hard Rock, they have this huge spa, and they sell all sorts of interesting things.
Yes. But I want to make it more in the medical side. I want to put then some vitamins, some maybe herbal tea, and things that are
right.
really
Right.
for your health.
Yes.
Yes.
Yes. Oh, yeah, that's good. Teas and, I like that
and
idea.
vitamins and
Yeah.
supplements, things that we need, vitamin D, vitamin E,
Right.
collagen for the skin.
This is very, very wonderful that you're going to do this. So now you walk in, and then the next thing are the massage rooms. And they're really beautiful, and it's very comfortable. Then I saw where you had another room where, well, first of all, you walk in, and to the left are beautiful chairs
Oh, they are
for the
excellent.
pedicures.
For
I've
the
never seen.
pedicure.
Oh, they're,
And,
they're expensive chairs,
Well,
I have to tell
being,
you.
being a medical doctor, one of the things that I am very concerned is about
Feet.
transmission of infection from one customer to the other. So some of the pedicure chair, the old-fashioned one, you will fill it up with water, then that customer come off, and then you clean up, quote unquote, you clean up, and then the next customer come and sit down. This one has plastic container that you use per customer. So you put the plastic container in there, you take care of the person's feet, and when that person leave, you take the container with the water, you throw that out, you clean the base, but the next customer, we get, their personalized container for that moment.
So it's another container that goes in there for the next
For
person?
each customer.
I've never heard of that
For
before.
each customer. So that way there is
Whoa.
no transmission of any kind of disease or anything like that. It's it's basically give the comfort to the customer that,
That's great. Well, I noticed the chairs were gorgeous and comfortable, but I didn't understand that. That's
Yeah.
great. And then, of course,
that means you have to go back 3 or 4 more times.
Right. I've got to get there. So then I noticed also that you're going to have hairstylists.
We already have, several hairstylists working there. And
They'll do coloring and they'll do everything.
Right.
Okay, and that's in a separate room, which is lovely. And then, of course,
so when you have that waterfall that you mentioned,
right
right
behind that is where
the
they
waterfall, that's where the hairstylists are.
All right, and then we have people who are getting their manicures.
And then you have the people getting their manicure section. And then you go into the change room. When you're going to go for any type of therapy, you go and change in one of those rooms. And you have personalized lacquer. You can lack your personal belongings
well, that's
there.
important. Wait, I've never seen that before except a real spa.
Right.
A big spa. That's right. You go in, you lock your stuff
you
up.
like your personal belonging, and you go and, relax, and, that you'll be taken care of. So you put your personal belonging there, and then you put a robe on and go and get either your massage or your facial.
Or your salt bath.
Or your salt bath.
You have, the other thing, though, as you're walking through that.
And then the relaxation room.
Oh, yeah. Definitely.
Yes.
See, you have those. When I've been on cruise ships, they have things like this.
Right.
But but I couldn't imagine. Then when I first walked in, I didn't realize how large the spa was.
It is huge. It's huge.
But it's elegant. It's all been refurbished, so it's so beautiful, Dr. Mencia.
Very little thing need to be done.
That's right, because I know you like to do a lot of these things to make everything very beautiful.
But it was, beautiful as just like that.
So now after we've done this,
then you come around.
Yeah.
Then you have there's one big room that I'm thinking of a sauna.
Yes, that's right. Right now, it's a different kind of a thing, but I don't know about that. But it's okay.
Yeah, I don't know about that either.
But I have seen that. Oh, wait, your shower. I love when you go in your shower. I saw you have, I forget what they call them, where the water's coming from all over.
Oh, those jet water.
Yes, the jet water.
Jet massage.
So that's really nice, too, when you've just gotten cleaned up after your massage.
And the salt bed is in a room all by itself.
Yes.
Very private.
That's really what I'm going to go and do. I'm going to get there.
Yeah, I have to do that. I want to do it myself.
Yeah, I love it. Now, I did notice one of your massage rooms has a couple massage. You have 2 beds.
Absolutely. A spa of this category, this huge, you have to have, massage for couple.
I've never
so
seen that
you can
before.
go with your significant other, or you can go with your worst enemy. And
they won't become your worst enemy, right?
Kill him.
But it has been very carefully thought out. I mean, that's what impressed me. I really didn't know what you did. I said, "Oh, he just bought this bottle.
Yeah.
What's this going to be like? That you're going to have to fix it up." You couldn't do anything to fix this up.
No,
this
it's
is
so
beautiful.
perfect. It's really good. It's excellent.
And then
it's so
absolutely your medical part of it. You said you were
and then
talking
the medical
about nutrition.
part we have 3 other rooms that are behind the hairdresser. We have 3 suites over there, and then that's what we're gonna do: the laser and the fat reduction and the fillers and Botox, and all the medical section is gonna be in this area, so that we keep it more private, from the rest of the spa.
And of course, Enid was saying when you arrive, if you want a glass of bubbly or you want something, it'll be there for you.
Right, sparkling water or flat water. No, just kidding.
You're bad. But actually, I was thinking about what you're saying. Someone could literally go and start at 9 in the morning. You would probably get them lunch. And then, because there's a lot of nice restaurants around there, you can get them lunch and bring it in. Mm-hmm. And they'll be finished at 4 o'clock. There are enough things there that they could have a whole day. Their hair, their nails, the massage, salt bath. I mean, this is really exciting.
Can have a little cheese and
no, you're going to need to do that.
olives.
That's right.
And all that good stuff.
Some wine and cheese, right? And make them feel very comfortable. Well, Ina, of course, is such a hospitable person.
She is,
and she is going to be running this, and that's how she is.
And she has such a good eyes for decoration, and
No, she is. I think if you do go there, make sure if Ina isn't there that you ask where she is, because you do want to meet her. She's it's the European. Most of the best massage therapists and facialists that I ran across were either Russian or Hungarian or someone. Well, I don't know what makes the difference.
Well, I guess people that have grown up here in the United States, many good things for us, but the abundance of things sometimes make us bad. So they come from a society that every little thing have to be preserved and utilized. And I remember in one of my construction in the office when I was remodeling the dental area, I said, the guy is a high-end construction individual from Cuba. I used to work very high-end in Cuba. And he goes and we're breaking this wall, and he's very like a surgeon removing the shear rack. I said, why he's doing it like that? We just take a hammer and boom, 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 hammer down. You just remove the shear rack. And then when he's doing the construction, he took the shear rack and flipped it over and put it back in. I said, wow, this is so good. I mean, they're brand new. They're really brand new. It's a brand new building. He said, if this is a 40, 50, 60-year-old building, we'll break it. This building is brand new. Why destroy this? So I guess the same thing goes. One of the esthetician that we have, Stonewater, she's a dermatologist in Russia. I mean, and that's the kind of level of service I like to provide. It's like some of my medical assistants, they are doctors in their country, and they work as medical assistant, but the patient can perceive that this person is very knowledgeable. When they draw the blood or when they take care of a wound, they say, wow, you really know what you're doing.
If there's a different level of care, I don't want to say American doctors aren't, but I have noticed that a lot of foreign physicians or facialists or massage therapists, they do have a different technique. They just work differently.
Imagine the esthetician, being a doctor in her country, and she's doing a facial. I mean, this lady knows the anatomy from your bone to your skin and beyond, all the way to the brain. And so when this person is working on you, it's you look at the skin around your face, and the thinnest part of the skin is on the eyelid. So you have to be very cautious what kind of product you put on the eyelid, just to give you an example. So when I'm doing filler, when I'm doing Botox, we all recognize as physicians the anatomy, and that's what people need to understand. There's a lot of estheticians out there. There's estheticians that taking the course online. They never been to a class.
And
but to be continued.
We're going to continue. We're going to continue. Look up Stonewater Spa.
Don't go anywhere.
Don't go anywhere. We'll be
right
back.
Get a cup of coffee.
Yeah, get a cup of coffee or a glass of wine, whatever. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.